I want to get back to the delays in testing. Researchers at the University of Pennsylvania recently found that testing sites serving communities of color in big cities are fewer in number, have longer lines, and often run out of tests faster when compared to sites in wider areas in those same cities. As former Federal Reserve chairs Ben Bernanke and Janet Yellen told the Select Committee, nothing is more important for restoring economic growth than improving public health. Yet we have the president that says, slow down testing, please. And the most vulnerable among us are being impacted. Frontline workers, small businesses that cannot reopen safely, and Black and Latino populations. So I have some questions along these lines. Dr. Fauci, I have a simple question for you. Do you attribute this inability to control the virus to the delays in testing and contact tracing?
Thank you. Control of the virus is clearly a multifaceted process that involves many things, the most important of which is what we were just speaking about before, about testing, about masks, crowds, outdoor versus indoor, distances, et cetera, et cetera. We've been through that multiple times during this hearing. Testing is a part of the process, but the process of controlling infection, when you're talking about contact tracing, obviously you need testing, and you need testing back within a reasonable period of time. And the concern that you're expressing is for the days that it takes, and Admiral Giroir has addressed that several times during this hearing. But testing is a part of the comprehensive approach, not the only thing, but as part of the approach.
Thank you. South Korea had rapid results for testing and tracing, and the virus is essentially contained there or gone. Do you agree that what they did with respect to testing helped those countries get the virus under control?
Virus and the control of some of the Asian countries were due to a number of factors. Their ability to shut down almost completely, as I mentioned in a remark before, to the tune of 90+%.
Did they rush to reopen the economy?
No, they shut down. They had the capability, because they got down to a very low baseline, to do adequate identification, isolation, and contact tracing. Right now, they are trying to reopen. It's going to remain to be seen how successfully they do that.
So, for the record, does testing result in the U.S. seeing more COVID cases, or are other factors causing the spread? Does testing result in the U.S. seeing more COVID cases, or are other factors causing the spread? Okay. So, are we seeing more COVID-19 cases in the U.S. because of the testing results?
Obviously, if you do more testing, you're going to see more cases.
Okay.
But the increases that we're seeing are real increasing in cases, as also reflected by increasing in hospitalization and increasing in deaths.
Why is that professional sport leagues can get testing turnaround times within 24 hours, but we cannot do it for all Americans?
Well, some of the sports clubs have been using the rapid test, which is really very different from the test that requires extraction of DNA and takes time in a different machine. So they have bought a bunch of machines that allow testing to take place where you get a positive back in 5 minutes and you could declare negative in 15 minutes.
Dr. Redfield, do you support the fact, do you agree with the fact that there is a disproportionate testing going on among Latinos, Black, Native Americans?
I wish the Admiral was here to answer it, but I've heard him answer this before, and Tony may comment, that he has set up disproportionately these testing sites in areas that have indications of more complex social economic status. I don't remember the exact number, maybe Tony does, but more than 70% intentionally trying to target areas that may be more disadvantaged. So I wouldn't agree with that statement, but I would like the Admiral to be able to get back to you with the specifics.
So you haven't seen the long lines in the urban cities and also in states where we have large population of Latinos and Blacks?
I've seen the television lines. What I was trying to say when you said, was it specifically disproportionate for Hispanic, Latino, or African American or Native Americans? And I'm not comfortable supporting that comment. I would rather get the specific data from the Admiral, which I do think the system has really gone over the other way to try to make sure we've enhanced the community health centers and these federally assisted testing sites in areas that are specifically more disadvantaged.
很快就可以跟朋友再聚，还有家庭聚会、游行、体育盛事和音乐会。为了帮助社区在重回正轨的时候准备就绪，请立即回复2020年人口普查。现在上网花几分钟的时间，即可影响到医疗保健、公共设施和教育在未来10年的发展。立即上2020census.gov 填好问卷，让美国有更美好的明天。事不宜迟，展开未来，即刻上2020census.gov/languages 回复人口普查。